Welcome, everyone. It is 8:45 in the morning. This is Rosa Soto with Los Angeles General Medical Center Foundation and the Wellness Center. So glad that you're all here with us today. Buenos días a todos. Esta es la Junta de Health Innovation Community Partnership. Las prioridades de la comunidad. Es nuestra junta mensual y nos da mucho gusto que estén con nosotros. Recordando que hay un globo de interpretación abajo en el panel de su imagen que pueden impresar y escoger el lenguaje de su preferencia, inglés, español. So good morning, everyone. Rosa Soto with the foundation, and wanted to welcome everyone to the monthly meeting of the Health Innovation Community Partnership. So reminding folks that there is simultaneous interpretation that is available in clicking the interpretation icon at the bottom of the screen. We will be getting started in about 1 more minute. Okay, so we're just about 5 minutes over time. So let's go ahead and get started. Buenos días a todos. Good morning. And today I'm going to be joined by Elijah, who will be helping me with our tech and logistics. So Elijah.
Hi, good morning, everybody. So here are some tech tips for the Zoom meeting. This meeting is being recorded and will be posted to the HICP website. All attendees must please mute yourselves unless you are speaking. Turn your audio and video on or off before clicking the microphone or camera. Click the raise hand button if you want to ask a question. Type questions in the chat. Interpretation allows you to attend in your language of choice. And then an overview of today's meeting. We will be having a meeting overview with the guiding principles and agreements. Then we'll have a Los Angeles General Medical Center update, followed by the community health update, campus projects report back, juvenile justice, regional plans report back, and then partner announcements. And then the HICP guiding principles. All participants agreed to basic principles prioritizing equity, community, resilience, and health in all programs and projects. All participants agreed to approach issues with an open mind, be willing to engage in dialogue, and commit to thinking boldly about solutions. Participants will state views and ask genuine questions. Participants will seek to avoid monologues and arguments, move to conversations where participants are curious and seek to understand various points of view. Participants will explain reasoning and intent, share how we reach our conclusions so that others can understand our divergent reasoning. Participants will attack the problem and not the person, organization, or institution. Participants will define key terms so that we can attain a shared understanding. Participants will share all relevant information. Participants will always arrive prepared for the meeting. During meetings, only one person speaks at a time. We will not engage in sidebar conversations. Participants will work to develop a comprehensive common set of information with which to solve problems and make decisions. And lastly, participants will jointly design next steps. Now back to you, Rosa.
Thank you so much. And otra vez, agradeciendo que están con nosotros.
And once again, just thank you so much for being here today, and also our community. If you wish to hear interpretation in Spanish, you do have the feature at the bottom of your screen where you will see a globe icon, so you are able to listen in your preferred language.
So vamos a empezar hoy. We don't have to go through everything. Yeah, that's totally fine. Leave it right there. Thank you so much. Vamos a comenzar hoy con...
So then we will start today.
Back to English, I apologize. We're starting today with Jorge Orozco, the CEO of Los Angeles General Medical Center. Always a pleasure to have you on, Jorge, and just appreciating your leadership and ever partnership with our community work. Jorge?
Good morning, everyone. It really is a pleasure to be here. The voice of our community is our guiding light. We value it. We look forward to it, and this is an important forum for that. So it's always a pleasure and an honor to be here. Let me start with COVID. There is a significant uptick in COVID transmission in the community. But the good news is individuals aren't really being admitted to the hospital for it. We rarely see any admissions for COVID. So it really is a different disease these days. I think the effects of vaccination, the effects of exposure in previous infections really has increased community immunity. And so the disease is mild. So that's a really good news. Next slide. Just a few announcements. This is something that was asked for by our community. And so now we have a very succinct, very nice pamphlet for any visitor who comes onto our campus. Our campus is very difficult to navigate. And so we've developed this pamphlet in English and Spanish and is now available at all entrances for our community. Next slide. Very happy to announce that LA General was acknowledged and honored for their work in opioid management. As you know, medical professionals often contribute significantly to opioid addiction in terms of how medicines are being prescribed, when medicines are being stopped. And we've taken this on as an organization and as a department across health services to really manage this in a responsible way. And our work has been recognized by the California Health and Human Services Department, our Hospital Quality Institute, and Cal Hospital Compare. So we're very proud of that work that we're doing. Next slide. Just a few parking lot updates. Parking is a challenge and continues to be a challenge. We've really stepped up enforcement of employees parking in patient lots. We need to prioritize our patients and our visitors. And so we've seen a significant reduction of that. And also lot 10, which was down for repairs, is now fully open. We've reserved lots 5 and 9D exclusively for our patients. We've also installed, I think, about 45 additional EV chargers into our parking lots. And so we're continuing to expand the availability of electrical chargers for vehicles. Next slide. And then finally, this was an amazing event, an amazing accomplishment. We opened a mobile clinic at Woodrow Wilson High School in El Sereno. In partnership with Supervisor Solis and LAUSD, LA General was very happy to open this clinic right on their campus. We're starting with sports physicals, but the amount of services and the types of services will be expanded. But this is a great example of our commitment to exceptional care in our communities. And if you're interested in watching the video of the grand opening, there is a link on the next slide here. With that, I open up to any questions that anyone might have.
Thank you so much, Jorge, and being able to join you at the launch of the mobile clinic at Wilson High School. I do want to share with the Health Innovation Community Partnership that this too was a platform that contributed to this mobile clinic coming to fruition. It was in this very center at the Wellness Center that our doctors and Jorge met with students and families from Wilson High School, first at a town hall meeting at Wilson High School, and then in follow-up here on our campus to understand what were the needs of our students in the community. And it was from those discussions that they continued the work to launch this mobile clinic. So a lot happens in the space of the Health Innovation Partnership, and we thank each and every one of you that attend these meetings, and Jorge, your leadership and the leadership at the hospital for always responding and making this happen. It was an extraordinary day. You had the cheerleaders, the band, a lot of excitement from the students, which we don't normally see around health. So it was so great because I feel like they really felt it their own. You know, they were heard. It was because of them that it was happening. And I think they wanted to celebrate that with you and with the clinicians. So thank you so much for that wonderful day.
I think Adi has a question.
Yes. Thank you for doing this at Wilson High School. I know that there's probably a lot of students there and plenty of work. But I'm wondering if family members can also use that clinic as happens in some of the community clinics that are established in other schools.
Yeah, at this point, we do not have access to family members there. Really, we are looking at expansion of hours and expansion of access of this clinic. And I think in the future, that certainly needs to be an important consideration. Absolutely.
And Jorge, I think along the same lines of Ari's question, what about other students that may not attend Wilson High School?
Yeah, right now it's exclusively for the students at Wilson High.
And then a follow-up question, what kind of services does the mobile unit offer?
Yeah, at this time, it's starting with sport physicals, but there are plans in play that will expand it to have health screenings, vaccinations, and we're looking to partner with DMH and DPH to have the other departments have presence in the mobile clinic and will allow us to expand. So we're doing a lot of work. So we're just barely launched it. So we have plans for a lot more services.
Absolutely. Thank you so much, Jorge. And I also remember from one of the comments of one of the students that getting a wellness pass from class to be able to go to the mobile unit was a great asset to confidentiality and to building trust, that people do not need to disclose what they're going to the mobile unit for. And as you mentioned, as you expand services, right? Someone may be going to meet with someone in public health. Someone may be going to meet with someone on mental health or just their health and wellness physical. To have a wellness pass to that mobile unit makes it so accessible and so important for the kids to feel safe and connected, right? And really imagine wellness. So I heard that, and I think that is something really important, you know, that is sort of at the heart of this opportunity. All right. Let's see if there's any.
I have a follow-up, sorry.
Yeah, sorry.
What about, is there a collaboration with nonprofit community organizations that are doing health education work on different campuses, such as Planned Parenthood or an LGBT health outreach effort?
Yeah, we recently had a conversation with the Department of Public Health, and they have these community wellness centers co-located at high schools that do partner with Planned Parenthood and other organizations. And they were speaking to us in terms of having a presence in at Wilson High School. So I think it's absolutely critical to link available resources in community. And I know our team has reached out to several departments to evaluate the ability to do that. At this point, it's just LA General providing these physicals, which may not seem like a lot, but if you think about the requirements to participate in any sort of sports in high school, it requires parents to take time off work. It requires kids to miss school. And this is a very efficient, effective way to address a need that was identified by the high school students.
Thank you, Ari, for your questions. There's another question. They're coming through the chat to me. So with the increase in COVID, there's been a lot of conversation in the media about social distancing and wearing masks. Have the mandates changed? And, what is the mandate in the hospital?
The social distancing mandate was lifted a long time ago, and it hasn't come back. The masking mandate was just recently lifted for the hospital. So now there are no requirements for masking in clinical settings, which was the last remaining mandate. That's not to say that these mandates may not come back given the spread of the disease. So at this point, there are no COVID mandates remaining for hospital.
So it really seems like that communication in the media is more of a recommendation, right? Like a recommendation that people can choose to comply.
Right. And if you come onto our campus, there are many areas of clinical care that people remain with masks. It's become part of what we do. We recognize the safety implications of doing that, especially in high-risk patients. And so we continue to use masks in these high-risk areas. And Dr. Gonzalez, you had a comment or question?
Yes, actually, just a comment to piggyback off of that. And as Jorge says, I think we've just learned so much. And I can tell you from being in clinic that I think most of our staff has gotten used to this, and we know that it keeps people safe. And so they continue to do it, and they do it very appropriately too. I hear people saying like, hey, I was, at a family event this weekend, I'm going to be masking. And, if they know that they've had a high exposure, or even if they haven't, they're still masking. So it just kind of speaks to the way that, we've learned so much, and that we are taking all the good things that we learned from COVID and continuing to keep those with our practices.
Great point.
All right. Well, thank you so much. Thank you, Dr. Gonzalez, for your additional comments, and thank you, Jorge, for your ever partnership with our community and coming on to these monthly meetings to give an update on our hospital. All right. So next up, we have the topic of community health update, right? Which this month is health and wellness, specifically youth mental health and support needs post a pandemic era. So I want to invite Dr. Gonzalez, who is our medical director at the Wellness Center. We're so very proud of her and of urgent care here at the medical center, and Diego Rodriguez, who is with Alma Family Services, to come on and share a little bit about their findings for this month.
Thank you, Rosa. I was very excited about this topic, and I think that I've said this before, that we have community members that are just the best experts, and they have the expertise and the history to really help us take care of clients in a very special way. And I'm so happy and honored to be able to work with them on a daily basis. We know the difference that you all make in each and every one of our community members that comes to see you, and what you do for our community members at large. So today, this topic that Diego and I are going to discuss together, mostly Diego, mental health support for children and young adults, is something that has been on everybody's mind. Yes, for everybody in general, but we know that there are specific populations that are just a little bit more vulnerable. And it is really a great pleasure and an honor. And I'm very grateful to Diego Rodriguez, who is our very own Executive Vice President and COO of our Alma Family Services. He's a licensed marriage and family therapist, but I will say that above that, he is one of the greatest community advocates that I know, and always excited about doing all that he can along with his team in terms of support for children, young adults, and families in terms of mental health. So thank you, Diego, for being here. Next slide. Okay. So you guys have seen this photo before. You know, Rosa has said this before, and we all have said it. It takes a village. There's absolutely no way that I would ever be able to take care of clients all by myself. I do it with the experts in the community. So just a little reminder of what we do together, and every day we have everyday stories that can really pinpoint the work that all of our community members do. So just a little highlight. So today we're going to highlight a little bit more about what Alma Family Services has done. So next slide, please. So I did come up with some starter conversations for us. I encourage everybody to chime in the chat. I think it's, like I said, a very important topic for parents and caretakers, really anybody who's interacting with today's youth. But I did have some questions for Diego, and I know he has a great presentation planned. So some of the topics that I wanted to discuss with Diego today, and he could highlight for us, is really talking about the extensive history that Alma Family has already been doing for many, many years in our community. Sometimes it's a matter of like knowing what's out there, right? Like we're our own best kept secret. So really what's happened, what have they done? And then I think what we're dealing with now, and everybody has said this and realized this, is that the post-pandemic era is providing some challenges that are unprecedented. So what are they, and how do we prepare for them? The next topic is something that that all community members recognize on some level, which is that the mental health support is not going to look the same for everybody. Everybody's going to do it in different ways. Sorry about this clicking. I wish I could turn it off. Sorry. So I did want to speak with Diego a little bit about what unique strategies he has seen, and you know, what can we look to in the future? Like, how can we be unique, and how can we use new approaches in mental health support? And then lastly, the reason why we're all here is to be allies and to be supportive and to be partners. What are some of the ways that we can get involved? What are some of the things that we can do? And how can we get the word out? And how can we give parents and caretakers and anybody dealing with young people today, how can we give them hope? We hear about all the negative things. We're inundated with negativity. But I know that this team in particular has stories, many great stories of how we're impacting families one by one, and in that vein, actually affecting the entire community. So with that, I'm going to turn it over to Diego. Diego, again, thank you so much. I will mute myself and try to take care of this other problem.
Well, thank you, Carla. Thank you for your very kind introduction. And thank you also to the HICP for the opportunity to speak on this topic, which I'm very, very passionate about. Before I dive into some of the questions that you raised, Carla, just want to give a very quick intro and try to respond to the first one about Alma Family Services history in serving not only youth, but individuals of all ages. So if we can jump to the next slide, slide number 3, actually, the next one. Thank you very much. So Alma Family Services was founded in 1975 by parents of children with special needs. We were founded in East LA. A group of parents came together and founded this organization that has since grown into multi-services. There are culturally appropriate and responsive, multilinguistic services across LA County. We currently have 18 service sites in LA County. We have a couple of sites in the city side as well. And we provide, as you can see in the screen, a multitude of services from preschool education to through parenting, mentoring, parenting classes, socialization programs for individuals with special needs, youth development, community outreach services, CalWorks, but specific to mental health. Since 1975, we have been service providers and partners of the LA County Department of Mental Health. And I would like to really acknowledge and express my appreciation to LACDMH for how they have invested in youth mental health over the years, and through funding, but also by engaging community organizations such as ALMA in part of the solution. How do we support our young people? How do we support family members? And how do we support school communities and educators as well? And that's what I would like to highlight today. If you can go to the next slide. Thank you. So first, I would like for us to just have a common language and a common understanding of mental health. When talked about mental health, there's so many different definitions, right, of mental health. So my preferred definition is that mental health is a state of well-being in which an individual realizes his or her abilities and can cope with the normal stress of life. So we're talking about optimal mental health, feeling positively about ourselves, about others, the ability to cope with our past, the ability to manage today, and feel positive about our future. Unfortunately, as you might know, mental illness is incredibly common. Many of us struggle with mental health issues. And those struggles may range from very mild to moderate or severe symptoms that can be debilitating and can have a great impact in our lives. As a matter of fact, 1 in 4 individuals in the US experience mental health symptoms per year. And youth has the highest prevalence of what we call any mental health illness or general mental health, anxiety, depression, anger issues. But sadly, they're the lowest supported group across all age groups when it comes to services. They receive the least amount of services among all age groups. During the pandemic, if you can go to the next slide, we all experienced a increased level of isolation, of legitimate worry about our future, about our well-being, physical and otherwise, financial stressors, uncertainty about just everyday life. And that was particularly harder for our young people. Studies have shown that the rates of depression, anxiety, and other mental health disorders dramatically increased during the pandemic, especially for young people. There was a particular study funded by NAMI that found that 60% of teens experience overwhelming anxiety within the last 3 years. And as we know, 75% of all diagnosable mental health disorders occur or are very apparent by the age of 24. So the adolescent years are a critical period for all of us. And now, after the pandemic, we're hearing that over 1/3 of high school students and college students are reporting mental health symptoms that might be diagnosable. Unfortunately, the barriers that we had in the system, the mental health system before the pandemic, were only exacerbated during the pandemic, such as the stigma of mental health, the cost of mental health services, and the lack of availability or visibility of mental health resources, as Carla indicated. And finally, there's also the adverse impact of increased social media and other maladaptive coping skills had in our young people during and now after the pandemic. So both at the local level, but also the national level, and really across the world, we are seeing a greater need for mental health services, a surge in mental illness post-pandemic, and that has been particularly hard, again, in this vulnerable population. And why is that? So if we can go to the next slide. If we think about the continuum of mental health, and without getting too technical here, for our young people, if you look at this, I love this analogy of the tree, right? If you look at this tree, if you look at the roots of the tree, at the root, we might have unmet emotional needs, social emotional stressors, trauma. There are social determinants of health, family conflict, and all these different stressors are impacting our young people. What we see is the behavior. What we see is, the tree up there. We don't often see the root causes, but we get to see the behavior. And unfortunately, by the time that we see the behavior, that means that we need to intervene, and they're already at an early intervention or even at an intensive care level of need. The mental health system, especially here in the county, in the last 20 years or so, have really invested in prevention, which is great because prevention is the best way to support our young people. I will talk about different interventions, but I want to today expand a little bit in our understanding of prevention services. So the next slide, please. Prevention is putting in place protective factors that will support our young people. So by the time that they're experiencing symptoms and displaying some warning signs, there are already going to be resources, supports, positive individuals around them that can help them, that can support them, not only connect with, but stay through different programs and resources to address their mental health needs. Some of the warning signs that we are seeing now at a higher rate among young people are young people not wanting to do things they used to enjoy, or experiencing persistent sadness, hopelessness, or being very irritable, more so than what's expected for this age group and in the midst of a crisis. Young people displaying changes in personality, sleeping or eating patterns, the inability to cope with problems or daily activities, strange or grandiose ideas, excessive anxiety, thinking about self-harm or even suicide. Substance use has been a rise. And as you know, we are also now experiencing a different type of pandemic, a substance use pandemic, and an epidemic, really, of fentanyl use, and extreme mood swings and excessive anger, hostility, and violent behavior. A very, very sad statistic is that suicide is the second highest cause of death amongst people ages 10 and 24. So we've seen this really desperation and hopelessness at unprecedented levels amongst young people. So what can we do? And to your questions, Carla, what are some of the ways that um, for example, Almost First Family Services have supported young people? We do have behavioral health programs, outpatient psychotherapy. But over the years, fortunately, our founders and even our board of directors is comprised of individuals with lived experience, with former providers, with caregivers. So over the years, we intentionally looked for unique ways, innovative ways to offer behavioral health that demystifies psychotherapy and therapy, but also that is accessible and appealing uh, to young people. We offer psychotherapy at a number of schools. In Boyle Heights, for example, we have partnered with Roosevelt High School and Garfield, with Multnomah Elementary School, Soto. So with a number of different schools, and we go into the schools and provide the psychotherapy services at the schools. But we also go into the homes. We also have a youth center. We have youth development programs. We have partnered with the LA Mayor's Office, and through the Gang Reduction Youth Development or GRID project, which is also housed at the Wellness Center. We offer different youth development programming where they can develop relationships with peers that can be supportive in their time of need. We have offered parenting classes and just parenting mentorship. So parents are aware of different techniques and different interventions that they can use at home, and also different resources that are available in the community. And finally, we've been so blessed to partner with wonderful community-based organizations and other entities, such as the Wellness Center, that allow us to leverage different resources and to collaborate into unique projects. And I'll talk a little bit about one such project, innovation, that allow us to do different things, to use different tools, if you will, to serve not only the youth that is going through difficulties, but really the whole family and the community at large. Before I talk about the different programs, I want to highlight some resources that are available to all students, not only the students in our Boyle Heights community, but all students and all youth. So next slide, please.
Diego,
So
before you proceed, I just want to do, how are we doing on time? Are we still okay?
We're at time. We can give you guys 5 more minutes.
Okay.
Perfect.
Great. Thank you so much.
So
Okay, perfect.
Thank you. So in California, all kids under 19, disregarded their immigration status, have full scope medical thanks to SB 75. So we strongly encourage parents, community members to ask at their school what type of mental health programs are available for students, given that schools are the main point of access for preventive and early intervention behavioral health programs. LAUSD has a hub for wellness resources. This is the number 213-241-3840, where parents can call and receive navigation support and be connected to different resources. For other districts and charters, there are different types of programs and resources, but each school has contacts, and they may be school-based programs, or they call school link programs, or they may have a connection with a community-based organization that can come in and provide psychotherapy services. Next slide, please. The next set of resources are our very own LA County Department of Mental Health. They have a helpline, 800-854-7771, where individuals can be directed to different providers in their community 211 also offers this type of support, which they call referral navigation. And finally, we'll be sharing, it's on the screen, but I'll be sharing in the chat, a document which is called the Spot 4 LAC Provider Directory. And that's a list of all the different service providers in our area with their phone number and ways of reaching out to them and receiving the support that you and that your youth might need. I also want to highlight that we have Exodus Eastside Urgent Care Center, which has been a great partner for more intensive mental health needs of youth in Boyle Heights. Next slide, please. Also want to lift a few referral and hotlines. You might be familiar with 988, which is a lifeline that provides 24/7 free and confidential support. They have different numbers and different resources under the 988 umbrella. There's the LGBTQ Youth Trevor Lifeline. There is the Teen Line and also the California Youth Crisis Line. All of these numbers will be shared. And those are services where the youth themselves can call and talk to a live person, not just, get a referral through that number, but talk to a live person and receive support in real time. If I can jump to the last slide, please. Thank you. I just want to finish by expressing our appreciation also to Supervisor Ilda Solis. She has been an incredible advocate and partner for the wellness and mental health of young people in the county. And through her support, there's been different initiatives and under her leadership and the leadership of LACDMH, we have seen an expansion in school-based mental health programs and unique partnerships such as the in-school health center, which was a model created for Roosevelt High School and now has expanded into other campuses. And we're so happy to hear that Wilson now has also a mobile clinic, and that's a model that is set to expand. We also strive to leverage, and through Innovation 2, which is the project I mentioned earlier, we're able to provide not only the individual psychotherapy, but to educate the teachers, administrators, so they too can support young people cope with the impact of trauma, especially now in this post-COVID environment. We do have the Gang Reduction Youth Development Services in Boyle Heights, and that project, I know the name is Gang Reduction, but truly is a youth development prevention program and offers free online support groups, different activities for young people, and mental health support for at-risk, which we call at-promise youth. And coming up, we're working on expanding parenting support classes using breakthrough parenting and a teen community outreach services group, we call it COS, but it's just a space where young people can come together, learn different helpful tips to navigate life as a young person, but also as we identify mental health needs, we're able to help them navigate the system and get the resources they need in a timely manner. So with that, I will conclude my presentation and just want to check if there are any questions.
Thank you, Diego. Thank you, Dr. Gonzalez. Let's see if there's any questions from our Health Innovation Partnership. All right, seeing none, I feel like you guys did a very good job of, I think addressing, some of those questions that ongoingly come up in this environment, but also, just the resources that are available and how we're trying to address not just the issues when we can see them when they're identified, but to really focus on prevention. So thank you both. I do see a hand up, Maria Arellano. Maria?
María, you're
Ay,
muted.
disculpen. Sí, hola, buenos días.
Hi, good morning. I think this was so interesting just to know just how Alma Service is established for the first time and that it was parents with special needs, with kids with special needs. So my question would be, how do you address this situation with folks that live with a mental illness, but also have some kind of special need? How do you support them? And how do you do it through regional center or any other entity? Do you do any collaborative work? How do you support these kids? Because honestly, at this time, there was a lot of crisis. There's a lot of kids that have a disability, but also have a mental illness, and also develop a mental illness primarily after the situation with the pandemic and all of this crisis that we're living in. So our population is very impacted. So how are you supporting them?
Muchas gracias por su pregunta. Diego, would you like to answer?
Yes. So the question, do you want me to translate the question for the general group? So the question was, how do we support young people who might have special needs as well, might be working with the regional center, and what type of support do we offer to the family, given the unique needs of their youth? So there are different ways that we support them. The first is to work with the regional center. If they're not already connected with the regional center, is to make sure that they are and they're engaged, and work with the service coordinators to ensure that that youth is referred and is able to access different programs and services that will address their unique needs. The mental health needs of our people with disability are as complex as the mental health needs of youth that have a typical development. And that's why we do not treat any differently. Our young people with disabilities have their own psychotherapist, their own therapist, who is someone who's trained to be able to engage and support a person with disabilities, with the understanding that a person with disabilities have the potential and the capacity to benefit from counseling. And that begins at very early age. We at Alma, for example, have a socialization group, and we have children as young as 5, and some others as old as 20, 19, 20. And we also have an adult group, and we offer both individual and group support to address their mental health needs. I just want to finish with, it's really important to support the parents. And that's why through parenting groups, but also parenting classes, support from individuals with lived experience. So having parents of children with disabilities coaching other parents of children with disabilities is very helpful. And that's why we developed a parent mentorship program where we have actually hired parents with children with disabilities who have already navigated the system, that understands the complexities, the challenges, to show to other parents that they are not alone, that there is hope. There are services out there, and there are ways of assessing those services. It's not easy. It's true. It's definitely a journey, but there are a number of different systems, and now we have seen collaboration at a very high level across systems to address the needs of youth with disabilities and those with atypical development as well.
Thank you so much, Diego. And again, thank you and Dr. Gonzalez for bringing this presentation to the forefront. There's a lot of positive comments about your presentation coming through the chat. Appreciating, again, your time today. All right. Next up, we have our campus projects report back segment. And we have Cynthia Mejia from National Corps talking about Las Dalias on 3rd and Dangler. She will kick us off. And then after her, Gilbert Gonzalez from Century Housing will talk about our permanent supportive housing. Cynthia?
Hi, Rosa. Good morning. Buenos días a todos. Thank you for having me. I am pleased to be back. It's been a while, but happy to share an update on our upcoming affordable housing community in unincorporated East Los Angeles, which was formerly 3rd and Dangler, titled for its location, now renamed to Las Dalias. Next slide, please. Again, my name is Cynthia. I'm an assistant development manager with National Community Renaissance of California, or National Corps for short. Our organization is based out of Rancho Cucamonga, and it was founded in 1992, so about 30 plus years, and we're one of the nation's largest affordable nonprofit housing developers. We pride ourselves on developing properties, building them through construction, managing them in-house, and partnering with our sister nonprofit organization, the Hope Through Housing Foundation, to provide supportive services on site. Next slide, please. So as I mentioned, the site was referred as 3rd and Dangler prior or previously because of its location. So on the map here, you can see it's right between the freeways, the 710 and the 60 off 3rd Street, so right along the Metro L, or formerly Gold Line, in unincorporated East Los Angeles, and the cross street is Dangler Avenue. Previously was comprised of 6 vacant parcels there that were owned by the county. And our organization set out to develop this property with affordable housing a few years ago. So our project is comprised of 78 residential for rent units, which will be comprised of 20 studios, 49 1-bedroom units, and 9 2-bedroom units. And half of those apartment homes will be set aside for households that are transitioning into stable permanent housing. And we are partnering with people assisting the homeless or PATH to help provide supportive services for them. In terms of on-site amenities, the property will provide a community room on the ground level. The project is comprised of 4 stories. And then in addition to the community room, also on the ground floor, there will be a tot lot for our residents, a rooftop garden, and other kind of rooftop spaces. It's a small parcel. It's only a ½ acre, so it's really dense, but we're maximizing the kind of roof spacing to provide that kind of open air access. Next to our parcel that is being developed as housing, we purchased a lot and are building a public pocket park for our residents and also for the community to have a open green space. The project will provide on-site parking for our residents through a multi-level, two-level subterranean parking structure, and of course providing supportive services on site. Next slide, please. So in 2019, we set out to develop this property with affordable housing. We signed an exclusive negotiating agreement with the county and went through a robust community engagement process and partnered with the Wellness Center and many organizations in unincorporated East Los Angeles, including Alma Family, which rendered their support and helped us get approval from the County Board of Supervisors for this much needed affordable housing opportunity. In 2020, we set out to apply for various sources of funding. We were successful in securing an award from the state's Affordable Housing Sustainable Communities program, as well as tax credits and a supplemental bond. In 2021, in June of 2021, we broke ground. We started construction And we are fast tracking. We were supposed to be complete, all done with construction in June of this year, but we ran into a little bit of a delay. So we are now anticipating completion in February of next year. So later this year, we will be starting the leasing marketing process, and applications will likely be available in November or December of this year, with construction completion anticipated in early 2024. Next slide. Some of the benefits that this development is providing to the community is revitalizing the formerly vacant site that was, along the Metro L line, prime location. We are providing 78 deed restricted affordable living units, a number of on-site improvements. When we actually started digging in June, we did need to relocate a storm sewer line, as well as a utility light by Edison. So a number of kind of improvements, and also revamping of those lines, relocating, as well as, sidewalks and other improvements that are for pedestrians in the area through the HICP program. So there will be like bus shelters that will be constructed for either Metro bus stops or LADOT bus stops within a mile of the property. A new walking path will be created at Belvedere Park with new lighting. And buses will be purchased, or given money to purchase for Metro, for them to be electric and reduce kind of the pollution in the area. So a number of on and off-site improvements. During the construction and operations, direct and indirect jobs will be provided. We'll talk a little bit about that in the next slide. And then in terms of the community room on the ground floor, we will be partnering with local community-based organizations to provide a menu of supportive services for our residents, and those will also be available to the public, in addition to a community lab space there. Again, the Pocket Park, which will be adjacent, owned by National Corps, but publicly accessible during business hours. And then, a mural that will be fronting 3rd Street. So adding a touch there. Next slide. The Pocket Park, which is going to be developed right next door, as you can see in the top left image, is right adjacent to the property. It's about a 20-foot wide strip of land, but it was going to be vacant, so we acquired it. And proposed to incorporate an open green space, which we feel is really needed, and just a breath of fresh air to be able to, provide and have this space with, a kind of a play structure for kids, a landscaped area, several trees with benches, a water fountain, a bottle refill station, dog fountain, some benches for kind of picnicking or seating during, lunchtime, or, students. So again, this will be publicly accessible. It will have a gate for, business hours, but it will be open to the public. Next slide. For all of these amenities and public benefits, we actually conducted robust outreach and had a committee structure. So the Pocket Park design was informed by that committee, including members of the community, members of local organizations, to help inform what those needs were. And local hire was another component. So we did partner with LA Housing Compliance, or Power to Workers, to oversee our local hiring requirements for the construction phase of the property. Power to Workers is reporting directly to the HICP targeted worker meetings that are occurring on a regular basis. They're continuing to engage with schools like Garfield, Roosevelt, with local colleges, community-based organizations, and encouraging our subcontractors during the construction process to hire workers from the immediate area. In addition, we're excited to announce that we are partnering with La Causa to implement a youth build program towards the end of this year. So young adults between the ages of 16 to 29 who are interested in perhaps going into construction will be able to be hired through La Causa and be able to work on site with our subcontractors at the end of this year to obtain needed training and kind of job exposure, and hopefully a job immediately down the road. So we're really excited for that partnership. Next slide. A local art component will be installed or will be implemented as part of this community as well. We partnered with a consulting firm which helped us issue an RFQ request for qualifications from local artists to solicit interest. We received a really great submission from a variety of artists and ultimately selected Stephanie Mercado through a committee process also. This is going to be her first mural. She's an up-and-coming muralist from Boyle Heights, and we're really excited to see her work coming soon. The art mural is currently under production, and it's going to be installed in January, so very, very soon. And there was a really exciting community engagement process that informed the design for the mural. So there's images that are, reflective of the culture, the vibrancy of East Los Angeles, and it'll be very beautiful. We're thrilled to see that come to life really soon. Next slide. So in terms of next steps, we are looking to finish construction early next year, so preparing now for the leasing process. We are looking for interested community members and advocates who would like us spread the word about the leasing application window, what the requirements are. Our team will be hosting a leasing information workshop very soon, over the next month or so, ideally, at the East LA Library. So if there are any members who would like to be a part of not only the workshop, but helping us spread the word to ensure that residents in the community that might need this housing are informed on the application requirements and know when to apply, where to apply, what that process will look like. So I'm going to post a link in the chat with a survey. Anyone who is interested can, feel free to mark yes, you are interested in participating, share your name, and if there are any organizations you'd recommend to be part of the process, let us know. In addition, for the leasing process, we'll be working with the county to lease up the supportive housing units. Again, that lease up process will be happening later this year. And then, we're thrilled. It's been a long time coming. This project and process has been a very it's been tumultuous, but during the pandemic we still were able to really conduct a lot of community outreach, work with partners to formalize a community benefit agreement, which is being overseen by the Wellness Center through the Health Innovation Community Partnership. And it's been just such a collaborative and beautiful process that we are proud to have been a part of and continue to be focused on implementing those commitments that we promised to the community. So really excited for early 2024. We'll be excited to be back once we have a scheduled date for the grand opening, and would love to see everyone there. Thank you. So I will link that survey in the chat, and I'm happy to answer any questions.
Wonderful. Thank you so much, Cynthia. We're gonna start with our hands. So Guadalupe Duran Medina, Supervisor.
Hi. Good morning, everyone. Thank you, Cynthia, for the update presentation. We really are looking forward to the culmination of this project. We know that there was extensive engagement on this project on many different levels, many different components, and that's what makes it very special, right? All the community benefits that are coming from this project. And we want just give a special shout out to all the community partners that have worked with us over the years on this project. And we're nearing completion of the construction, and now the lease up is also a very critical stage for all of us, right? It was lifted up as very key that we give a local advance notice on the housing opportunities that are much needed by our community members. And so we just want to have a special ask to everyone, if they can help us spread the word. I know Cynthia's gonna do an email to all the partners that wanted to be included to help spread the word. She's had one workshop and it was really well attended. We want to have at least another one where we inform the community, what does it take to get into the units, what are the requirements, the documentation, and help them also fill out an application, right? So all those are very key aspects. And again, we ask for your support. So again, thank you, everyone, and really looking forward.
Thank you so much, Guadalupe. And I also see a comment from Pam thanking CORE for agreeing to participate in this community benefit agreement. Remember, it was in this very forum that the discussions began around would there be openness to engage in a community benefit agreement, public dollars for public good. How can we improve the type of development that is already meant for our community, but in partnership with community. And it seems like, CORE has that as at the heart of your work. And so we appreciate that. It is an extensive process and it's a huge commitment. And as you said, Guadalupe, the commitment of the partner organizations, the commitment of our community leaders to continuously come up to the forefront when asked to participate in the workshops, when asked to participate in this. This is exactly what Health Innovation Community Partnership was launched to do. And we appreciate that there's more than one effort, as Pam pointed out, that really demonstrates that working together in community, right, we can build incredible spaces for our community to thrive. So thank you again for this presentation. And for your continued commitment, to this project being an effective demonstration of partnership in the community.
Absolutely. Thank you for having us.
Is there any other comments or questions that folks have for the Las Tarias project? All right, and we can continue to take questions at the end, but we're now going to talk with Gilbert Gonzalez, who's here from Century Housing, to give us an update on the Restorative Care Village permanent supportive housing right on our campus. Gilbert?
Great, thank you, Rosa. And nice to see you again. It's been a little bit. So this presentation is following up our update from a couple of months ago. So we were dark in August, but the meeting we had in July, we presented an update on our in-person community engagement workshops and other community engagement efforts. And we looked at the different feedback that we received. So I'm going to reference that a little bit here in this meeting, but I'm going to go through it a little bit quickly. I know we're also behind on time, but if you wanted to look back, we covered that in more detail in July. So you can go to the recording on the HICP website. But we'll go ahead and move forward. Next slide, please. So we'll look quickly at some updates on the design update process. If you could go to the next slide, please. So the past couple months, since we did present in July, we have been coordinating with Supervisor Solis's office, and we've had a number of back and forth. Supervisor Solis's office, and in particular Guadalupe, have really encouraged and guided and pushed us to continue to make revisions to our design, to take all of the different feedback that we received and see it incorporated in the design, and then also see the connection to the general hospital and to the nearby complex. The surrounding community there, and so we've been doing that over the past couple of months, and we have finally gotten to a place where we think we're ready. And so we have a meeting scheduled with the HICP subcommittee to next Wednesday. So a number of months back, we initially presented the design to the HICP subcommittee and got some good feedback. And it's been a number of months since then. We've had the community workshops that I mentioned, and we've made revisions, and we think we're ready to present that to the subcommittee next Wednesday. So that'll be happening. And then after that, after we get a chance to present the updates to the HICP subcommittee, we'll be able to present, kind of show the updates at the next HICP meeting. So you see I crossed out some dates here. I think we were hoping to have moved a little bit quicker than we did, but there were different things we needed to coordinate. One of the things we've also been doing during this period is coordinating with the city and the county, because different meetings that we have with those departments at the city and county also impact design, not necessarily aesthetics, but kind of structural things and where, how things are laid out and things like that. So we've also had to have a series of meetings with the city and with the county. Next slide, please. And the next series of slides are, again, this is material that was covered a couple of months ago. I think that presentation was maybe like 20 minutes, so you could go back and see this, but we put together an executive summary of the feedback that we received. And then we also broke down in a little more detail. Next slide, please. And we can come back to this if anybody wants to. I know we are short on time. That executive summary is kind of based on these different questions and feedback that we received. And we broke that feedback down during our workshops. We had prompts where we were asking community members to give their input. And then we also had ways to provide free-form input, anything that community members had to say. They could either express with our design team that was there or in note form. So these are questions that we wanted to get feedback on regarding design. Next slide, please. Next slide are questions we wanted to get back regarding landscape. And then next slide, please. And then this is just an overview of kind of where people were most active in terms of giving us input. So kind of where people had the most interest in having their voice heard. So again, I know I went over this quickly, too quickly to really digest. If we need to go back, but also again, explain more in a lot more detail a couple of months ago. If we can move to the next slide, please. So in terms of the design updates, that is the plan where we'll be meeting with the subcommittee next week. And at that point, we hope to kind of finalize the design and then be able to submit to the county for our entitlements, which is something that we want to do soon, so that by the end of the year, we have our entitlements approved. And so next year we can move forward on all of the different funding applications that we will need to secure to be able to develop these, the permanent supportive housing site. I also wanted to give a quick update on an upcoming in-person community workshop. Next slide, please. So we'll definitely have more details about this workshop next month. We're just starting to plan it. But it will be focused on when I saved it to PDF, it kind of messed up the way the font and the writing is. But with our next in-person community workshop, we'll be focused on community benefits, public art, and radical hospitality, which is a concept we've talked about previously. We're looking to have this in mid-October to early November, and a location still to be determined. So this is something that we'll set up a separate meeting with our HICP subcommittee on and begin to discuss some of these details with them. And then the rest of the slides, next slide, please. So community.
Albert, you're fine on time. Just wanted to let you know you have a little more time.
Oh, okay.
Okay. Late.
Okay. So community. So again, these are the things that we'll be discussing in our in-person community workshops. I think we'll plan to set it up as we did the previous workshops on design, where we had these interactive stations and really enable a good conversation and a lot of input. Regarding community benefits and amenities, next slide, please. You know, sort of like Las Dalias, which clearly has very robust, amenities and benefits for the community. We also are happy that this project is starting from a really strong place. Just a reminder that, you know, we really, from the very beginning, even when we were proposing the project and conceptualizing it and submitted our proposal over 2 years ago, we really strived to match what we were doing at the project site with feedback that was already known, and, you know, primarily from the HICP and from all of the input that they had documented over the years. So this was this, again, just go over this quickly. We've presented this before, but these are just some ways that we, from the very beginning, tried to be in line with with, in particular, the HICP and their focus areas. Next slide, please. Again, this is something that we can get into a lot more during our in-person workshop and our discussion on the HICP subcommittee. But this is just some numbers and data that we researched and were able to learn in terms of the impact that the project will have on local jobs. That's both during in development and once the building is under operation. Cynthia mentioned with Las Dalias that they are working with Power to Workers. We'll also be working with Power to Workers or a similar organization. I'm sure there are others out there, but these groups, these nonprofits, are focused on really making sure that we realize that local and targeted hiring goals, and that we really are connecting people from the local area to these job opportunities. Next slide, please. And then just in terms of some of the amenities, again, that we envisioned from the beginning and incorporated into this project, a 12-bed peer respite program that we've talked about previously. It's kind of a step down opportunity for folks to stay after they've had more acute care, potentially across the way at the general hospital or at the other restorative care village acute complexes. Next slide, please. We also have our workforce development space, a kitchen, cafe, and retail. This will be located on the ground floor. An opportunity for job development, both residents and then open to the broader community. With both of these, we're working with established nonprofits that do this work and that will be operating. So with a peer respite facility, it's the peer respite, peer support, peer respite program. Forgive me, the name's on the previous slide. And for the workforce development space, it's LA Habilitation House that we'll be working with. And we work with both of these groups at other development sites that we have. Next slide, please. We've talked before about the extensive landscaping space that will be accessible to the community. It really will be an extensive amount of space. These images show a little bit of that, but you know, in previous meetings, we've kind of walked through just how much opportunity there is there. Essentially, the full ground floor is accessible to the community to be able to walk through, to access the cafe, to access some of our program buildings that will be accessible to the community. Not all of the program buildings will be, some of them will be specifically for the residents, the case management services that are provided to residents, and other services like that. But some of those structures that we're going to be building will be open to the broader community for workshops, and also the outdoor space is very conducive to gatherings of different types. Next slide, please. And then again, just following up on that green space, we really focused on limiting the building footprint and trying to provide as much open space as possible on the site. Next slide, please. Amenities, prominent opportunities for art. And it's you know, big footsteps to fill following Las Dalias and the amazing job that they did. But we've also you know, looked to create various opportunities. I'll talk a little bit more specifically about the art in just a minute, but this is another thing that we really wanted to emphasize right here. And the top image is the intersection of Griffin and Mission, so very prominent place there, and that's you know, one of the areas, and probably the most prominent area where we're looking to feature community art. Next slide, please. Mobility improvements. So Cynthia also mentioned the HICP program, which they were awarded. We will try to be awarded that next year. And that program provides funding for the development, but also provides funding for transportation infrastructure improvements. And so these are some of the ideas that, you know, that we've had. This is largely going to be a discussion with the city of Los Angeles. They're going to be our partner on the HICP, and we've learned that they really kind of dictate what these improvements are, but we're going to try to influence as much as possible. You know, what we've envisioned, what we've taken feedback from the community on in terms of being, you know, really good, really beneficial improvements. One of them, for instance, would be improvements to the intersection at Griffin and Mission. So really enhancing the comfort, the speed of being able to cross that intersection and make your way to and from the General Hospital complex and the permanent supportive housing site. Next slide, please. And then finally, this idea of a multimodal plaza where folks would be able to either through shuttle or through rideshare or through friends and family be dropped off and be picked up at this plaza area. This would be access to our site, and again with the intersection improvement I just mentioned, potentially access to General Hospital Medical Center across the street. Depending on where folks want to go, this may be the closest and most convenient point of access there. So this is another thing that we've envisioned here. Next slide, please. I also mentioned that we'll be focusing on murals and art with our next in-person community workshop. Next slide, please. And these are the kind of the two prominent opportunities that we have in mind now. We're open to discussion and talking about other types of opportunities, but we have reached out to Self-Help Graphics and art for the purpose of helping us through the process. Cynthia described a robust community engagement process, and we do intend to do something similar. And we're talking to Self-Help Graphics in terms of helping us with that, kind of being a consultant for us to hold different workshops. We are also hoping to have them be at our upcoming in-person community meeting as kind of a kickoff opportunity. That is, you know, this building that you see here is still a few years away from actually, you know, looking like this. So it's a little bit early to, it might be a little bit early to begin that process. Definitely right now. Next year, 2025 is probably when, when we haven't thought about it too much, but that might be when it makes sense to start to execute that process so that we're not doing it too far ahead. That may be an issue, doing it too far ahead as well. So we'll try to get the timing ideal with that. Next slide, please. And then radical hospitality. So this is something that we'll present a lot more on. Oh, next slide, please. Carrie Morrison may be on the call with us. I know she always joins these. So, this is a really important aspect of our project. There's Carrie. This is the way I've come to describe it. Maybe a little more technical. I'm sure Carrie would have something more poetic to describe it. But it's essentially a really enhanced set of enrichment resources for the residents, for the 300 households, individuals and families that will be living at the site. Resources that are brought into the site, so resources in terms of different programming, trainings, tutorings, and enrichment opportunities, music, drama, different things like that. So assets that are brought and resources that are brought into the site, and things that are held on site for residents to connect with there, but also opportunities for residents to connect off site. So creating those connections out in the community, so residents have places to go as well. If they want to stay at the site, they can stay, but if they want to connect to different opportunities out in the community, they can as well. I am done. I will turn it over to Carrie for just a second, just in case you had anything.
I'm so conflicted because I know you're in the middle of sharing all of these incredible community benefits that are important to our community. And so, if we can just take a minute or two.
No, Carrie is probably not looking. She's good. We'll have a separate meeting for, where we just focus on radical hospitality, both in terms of the subcommittee and in terms
of it, Gilbert. I appreciate that. And, as you said, we have a long journey ahead of us of partnership. And so we know you're continue to come back to give updates. And so I think this opportunity that we have to, kind of parcel different aspects to showcase all of the array of opportunity and connection, I think is extremely important. And so I think I also echo for you. And, I know that both projects are not at the same timeline, right? You guys are just getting started. We're still in concept, but I just wanted to echo what I said about CORE and their project, that you guys have been extremely receptive and open to the community benefits process, to participating in Health Innovation Community Partnership, and to truly taking on the role of partner with the community. So just appreciating you guys for also, I think, revamping at times your presentations so that we really understand and can see that we are talking at the same level about the community needs and demonstration. I know that isn't easy work. And again, just appreciating you and the entire team that you and CORE have behind you, responding and continuing to work on this important aspect of transforming community.
Appreciate that. Thank you.
Do we have any final questions for either CORE or Century before we move on? All right, I see Guadalupe also echoing on behalf of Supervisor Solis's team, so thank you again.
Thank you for the kind words, Rosa. Again, thank you.
Let's go on to the next presentation. So the next topic is juvenile justice. And as you might recall, we had a conversation a couple of meetings ago regarding the importance of reconnecting to the juvenile justice work in our community. So let me invite Ari Gutierrez Arambula to get us started. And then we're going to hear from Dr. Robert Hernandez from the University of Southern California School of Social Work, and Dulce Acosta as well from USC. Ari?
Yeah, thank you, Rosa. We just wanted to lift up this subject because we've seen some stuff in the news about our youth in the detention programs and whether or not we're all doing enough for that. But I'm glad to see that Dr. Robert has stepped up to talk to us a little bit about his work in this social, from the School of Social Justice, and so this work in juvenile justice. So, I'm here. I'm glad to hear that he's here so that we can learn from this and see how we can help our community as a whole. Thank you. Dr. Hernandez.
Thank you for inviting me here. It's such an honor to be here. It's such amazing. I'm glad I was able to catch the beginning of the meeting. I'm inspired. Gilbert, that was awesome. As a native Angelino, and I say this, my aunt was the first family to move into what is now known as the Ramona Gardens. And then my parents grew up in Lincoln Heights, also Dogtown, and I was raised in El Sereno. So that whole corridor, man, that's familiar, right? That's gente. So thank you for sharing that exciting stuff. It's a pleasure to be here. And I'm just going to share a little bit about what's happening, and maybe I could come back for a deeper dive into what we're doing and what we hope to continue to partner around with the community. So, right now there's so much happening. And I know Hilda Solis's office has been one of the true groundbreakers to really support a lot of our youth who are most susceptible to the criminal system, right? So with this, right now at USC, this sparked off back in 2020 in the wake of George Floyd, and we know what happened at that time. President Folt, at the calls of a lot of community members, listening sessions with faculty, staff, was really looking to redesign and reimagine public safety. And with that, we were looking at how can we really build a more responsible, just system, especially working with DPS, law enforcement, and our community surrounding USC. So a community advisory board was created that I sat on, and we were looking at how can we really envision this. And I was tasked with the responsibility of looking at pillar number 2, alternatives to armed response. And what we were uplifting with this recommendation number 16, and Rosa, I'll make sure you get this report. The whole notion was that USC should adopt a community-based violence intervention program, partnering with community intervention workers with a diversity of life experiences that allows them to be a credible messenger, but a license to operate, thereby being able to build and sustain reduction and promote peace in the community. This is so key because, we've heard a lot about credible messengers and people with lived experience, but the difference here is that we were able to start to define, and a lot of this comes from pre-grid. It predates the Gang Reduction Youth Development Department, and it comes from the two-prong approach, the community violence intervention model that was adopted into city policy in 2008, and it uplifts community violence intervention workers. But the uniqueness is that they hold what we call a license to operate. So it goes beyond the credibility and really promotes individuals that have community validation, street credibility that allows them to build rapport between community violence and really and to prevent and redirect community violence. What's so special about this is partnering community violence reduction specialists with social workers provides access to treatment and care. So what we did is we started to build what we call a youth violence community diversion program over at the UPC campus. And our first point of entry is working with university gardens. And it's so powerful because right now, when we think of diversion, it usually is referred through law enforcement, right? Here, we're attempting to take referrals through intervention specialists who have the credibility in the community, who come across youth that doesn't necessarily fit into traditional prevention programs, but the youth that will respond to somebody who has the respect in the neighborhood. And we're able to outreach to youth that are acting out their trauma in the neighborhood, and it's seen as defiant, but we're attempting to break what we call the trauma to prison pipeline. Because these youth are acting out, we usually have the referrals come through law enforcement. We could still, take referrals from law enforcement, but we're really trying to get in front of any system contact, whether it be the child welfare system, the juvenile justice system, and really, really disrupt that cycle of mass incarceration. So we started this. We've been working on it for the past year and a half. We kicked it off this summer in University Village. And right now we have about 75 youth contacts. We've met with over 150 parents. We've enrolled numerous youth into the program. We're building a youth council that could report straight to President Folt, because the whole idea is building a one community safety vision where everybody benefits from feeling safe and are included in the process and not excluded. So that's where we're at right now. We also have the Community Safety Conference at USC. We're going on our 9th year, and that's working with community. There's a lot of representatives from the Health Science Campus, local community-based organizations that we reach out to. We're hoping to have the next one at Health Science Campus. And really, it stems from 2015, where there was an uptick in community violence. And what we did was bring in those who are most impacted by community violence through these credible messengers who have a license to operate into the conference, treating them with dignity and respect, and making sure their experiences are captured so we could influence relevant practice, research, and policy that speaks to their needs and not driven from a top-down approach. So I'll stop there. I know I gave you a lot of information. See if anybody has questions. I know Dulce is here, who could also speak to this year's conference, the theme we're having. We have one for the first time happening in fall, in October at Mount St. Mary's, who reached out, wanted to be a partner. And like I said, the next one will hopefully be at the Health Science Campus in spring. We know there's been an uptick in community violence in the area as well, sadly. Dulce, are you there?
Good morning. Yes, Fernandez, and for sharing with us briefly about the amazing work that is being spearheaded collectively by our partners, with our community at the table, serving as experts. Because so often we speak about community, we speak about youth, and the ones that are missing are the youth and those that work with the youth towards.
Dulce, we're having some technical difficulties with your audio. You may have lost her. Dulce?
I think we lost her.
We lost her, Dr. Hernandez.
I'm willing to take questions if you have. And like I said, Rosa, I could always return and do a deep dive into some of these skiller programs that are happening. And it's only happening because of the support by President Folt. David has been a definite partner in this. David Galvez, as well as Sam Garrison, University Relations, our DPS. So it's really community driven. And that's what I'm about. How does community voice drive this process, even this practice model that we're kicked off in the UPC campus? And hopefully we could do something like it and similar at the Health Science campus.
Wonderful. Thank you.
Absolutely, Robert. Sorry. Thank you. Sorry all for disconnecting, but we see you all there.
That's okay, Dulce. Thank you. Okay, so we have two hands up. Ari?
Yeah, so my question is having just seen the presentation by on mental health and the arc of addressing issues, would you say that this is a preventive effort in terms of youth justice, trying to keep them out of the pipeline to jail, and also my other question, part of the question is, are you working with, which law enforcements are you working with? Because my understanding is that on USC campuses, including the medical center, there's quite a number of law enforcement overlaps, city, county, the facility, the general hospitals facility, USC's force, etc. So just wondering how you're addressing all that.
Yeah, so it is definitely a preventative approach. Also, could you hear me? I'm sorry. It is definitely a preventative approach, but I would say it's also more of a comprehensive integrative approach. So the ability to respond not just through prevention, but we're also talking about early intervention. Interdiction is now the term that they're using in the community violence intervention world, as well as reentry, right? And diversion as well. So it's kind of a holistic approach, which is where we need to go, because we know our communities don't operate in a very cookie cutter approach, right? Our families, we can't split up and say this is a prevention kid, this is intervention. It's all in one at so many levels. So it's definitely holistic in its approach and its design. Yes, you're right. Right now, there's so many overlap of different divisions. Right now, at the UPC campus, we're working with Newton Division. We're also working with Newton, who else? Oh my gosh, I'm blanking on the other two divisions, but they're included. And again, we're in the initial phases with the youth diversion, youth violence prevention program at UPC. So the point of entry is at a housing development, which is Section 8, and really starting an inside out approach. The whole hope is to build out a robust triage call center where, based on the dispatcher call that goes to DPS, or if they're getting calls from LAPD, it's streamlined. And then that's where the School of Social Work is operating as a facilitator to make sure we're able to reach out to interventionists to respond appropriately and accordingly, also connected with the social worker who has the training to do mental health wellness status assessments on spot in real time. And then we could approach it in the appropriate manner. So again, the whole hope is to actually get in front of any system contact. And that's the beauty of this right now, is that the referrals can come through community intervention specialists, schools, as well as law enforcement. So it's not necessarily the referral has to just be through law enforcement. It could come from multi-faceted areas and audiences, which makes it really nice to disrupt that cycle. I hope that answers your question.
Thank you. We have another hand up, David Galaves. Good afternoon. Good morning.
Good afternoon. Good morning. Thank you, Rosa. Professor Hernandez, Dulce, always great to see you both. It's almost every day, but it's always good to see you. Can you both quickly talk about the tri-county work that you're doing with San Diego, Orange, and Los Angeles, and how the incredible organizations here can work, can be a part of that network going forward?
Definitely. I let Dulce. Are you there? Can you hear us, Dulce?
Yes, but I'm going to turn off my camera because the Wi-Fi is a little loose. Not working properly. Definitely, we invite community organizations to come to our Tri-County Community Collaborative space that we hold in the fall. Hopefully, we'll hold it at the Health Science Campus this year on the east side, because this is a way for not only a network opportunity, but to bring the best practices that the community members and our organizations are practicing and receiving and sharing the different type.
And we seem to have lost her again. Well, we appreciate, I think this is an important introduction to the topic that we'll continue to respond to over the next few months. I know as Ari opened, there's been a lot of conversation in the press regarding this, but the deep work that you're doing, Dr. Hernandez, the importance of engaging community, sitting at an equity table with our youth and ensuring that we're, really driving solutions together is just such an essential is core to truly resolving the issues of juvenile justice. So thank you again for coming. Thank you for your leadership, and thank you for sharing your great connection to the community. We hope we continue to see you in this forum in the future.
Thank you for the invitation. Much appreciated.
All right. I see one of our board members for the foundation, Teresa Nuno. You have your hand up.
Oh, thank you, Rosa. I thought that, we lost time, but just very quickly. First of all, I want to say just great presentations all the way around. I was not able to attend a couple, but I'm so glad to see the fruition of so many projects that started way in 2017 and are coming to life. On this one, I was just wondering super quickly, because I know we're out of time. And just a few words. What's the sustainability of all this, Robert, and on this project? Like, what's
Thank you. And that's a good question, and that's the biggest challenge right now: sustainability. The great thing is that to kick off the initial phase of this youth violence prevention diversion program, President Folt provided some seed money to get us going and get us started. Now, the biggest challenge is, and the community has bought in 100%. That's the thing. Right now, we're going after different grant opportunities that are out there, and we're hoping also university will also continue to support. And then we're in the process of having the Community Advisory Board 2.0, the next iteration of what I was a part of, that's responsible for the implementation. They're going to be tasked with really raising the funds, going after advancement in different areas so we could sustain this. Because the most insultive thing we could do is start something and not sustain it, right? And that does an injustice to community. And right now we do have community buy-in. The people that are the interventionists have been contracted to make sure that they're messaging to community members, right? So that's the biggest area. And we're hoping that the new Community Advisory Board that's responsible for making sure it's implemented fully is able to go out there and seek the funding to sustain this. So thank you. That's always the biggest area of challenge, right? Especially when you're working with community. And we want to make sure that the funds we do have are going straight back into the community, that it's not at a high level. It's not stuck in the university hands or researchers take it over, right? That it is community driven and it goes back to the community.
Wonderful. I see a thumbs up from Teresa. Francisco Sanchez, is your question short? Can we lose him?
Yes.
You are.
I was just wondering, anecdotally, I've had people around the USC area comment to me that the increasing affordability brought by incoming students leads to a lot of, youth problems, jealousy, whatever it may be. I don't know the root causes, but is there some way to tether some of these programs to create, along with creating more affordable spaces and housing for people? Because that's one of my fears of the Keck Medicine Hospital, is that it will eventually down the line, because these things play over generations, lead to more problems because of growing unaffordability in communities. And with the resources that USC has, I think they have a lot more ability and capacity to have a multi-prong approach than simply just focusing and narrowing the scope to simply how do we address youth issues?
I'm right there with you, Francisco. My parents still live in the area, so we feel it. We feel the strain, right? And that's a reality. And I hear a lot of my friends that still live in the area, comment to me what's happening. And we need to build shared spaces. And this is the key about having a program like this and being able to make sure. And again, when we were having these listening sessions with community, as a community advisory board, the community didn't see DPS as a threat. It was mostly the student, like you're saying, right? It's because of them that we're actually having this strain, right? So as we move forward, the key is being able to include all community members, being able to share space with all community members, making sure, and this is why it's so key to have youth who aren't necessarily invited to the table, are pretty much ran off campus to be included, to inform President Folt herself, her executive team, of what's needed. And we got to make sure that that's actually is followed through with, right? And that we have these spaces that are designed for everyone. And that's why there's this whole one vision of community safety, that all are welcome, right? And we got to make sure that that is held to at USC. And we're just not trying to throw money at the issue, but really making sure we're including the community in the process. And I think this is a big part. And believe me, I would not get involved if it wasn't. Believe me, because I come from that community. I know what's happening, and I want to make sure that Gente is taken care of along the way. So I hope that helps you. I know it's not a concrete answer, but we're still step by step building this out.
Well, what an enticing, set of comments to end with, and appreciating you so much for being here. Again, we hope we continue to see you in this forum. We now are running a little behind, so please bear with us just a few more minutes. I have Karina Macias from Supervisor Solis's office with a final report back related to our original plans regarding transportation and the Metrolink.
Thank you, Rosa. Good morning. Buenos dias to everyone. I'm Karina. And if you probably haven't seen me before, but I wanted to introduce myself. I'm Supervisor Hilda Solis's Senior Transportation and Infrastructure Deputy. And I am happy to be here to make some really quick updates regarding some key transportation initiatives within the vicinity of the campus, but I promise I'll be back when we have more time to really dive in and when I have more substantial updates for you all. Next slide, please. So I'm here to really talk about three exciting capital investment projects that are underway, and just give you a status update on where they're at and an overview of where they're headed. So the first is the LA General Medical Center station, Metrolink station. And you'll notice that it's not the LAC USC station, because following the renaming of the campus, the supervisor in her role as Metro Board Director has asked Metro to help people find their way from what is now the Silver Line station there off the J line. And they're working on updating the sign so that people know that they're headed to El General when they're getting off of what is now the busway station. And in the future, it'll be a Metrolink station. So last year, Metro helped, working with Metrolink, the regional rail provider, completed a feasibility study to help understand whether this station would be a good candidate and suitable location for new Metrolink station on the agency's San Bernardino line, which currently connects people from Union Station in downtown LA all the way out to San Bernardino. There's existing stations at Cal State LA, El Monte, Baldwin Park, Covina, Pomona North, and Claremont in LA County. Following that feasibility study that happened last year, Metro and Metrolink determined that this would be a station that would attract ridership, and that there should be an environmental process and scoping process and community engagement to identify what should be the design of the station, and also what are some improvements to the first and last mile pathways that are needed so that people who would be traveling to the new station along with the existing busway station would have the greatest possible access. In addition to that, there's the Marengo Siding Extension Project. This is a project along the existing Metrolink rail right-of-way, and it's intended to expand the ability for Metrolink to provide more frequent service. A siding track is essentially, instead of having a single track where all trains, that's their only way in and out of a station, a siding track is basically a track that goes off to the side. The train that is on an express route can go through the main track, and then the other train can come out and continue on its journey. So it just creates more capacity without having to do the double tracking. That is part of Metrolink's SCORE plan, which is essentially is a regional rail plan to improve Metrolink to be faster and more reliable. So the last project that I'm offering an update on is not a county project, not a project that is directly stewarded by the supervisor's office, but we have been tracking this project because it is close to the campus, and that's the Valley Boulevard Multimodal Improvement or Transportation Project. That's a City of Los Angeles led project. As you know, the City of LA controls the streets and owns the rights of way around here. They are looking for ways to improve bus transit service reliability, and improve access for different types of modes. So in the next slide, I have a couple those quick updates for you. So on the LA General Medical Center station, the planned station, we're working now with Metro and Metrolink to secure two types of consultants. One is the environmental and design services consultant. So they would be responsible for clearing 3 alternatives through environmental review, as well as preparing design plans for the ultimate scope of the project. And then, of course, the community engagement consultants would concern themselves with involving groups much like this one, definitely you all, to help identify what station design makes sense, and what access improvements are needed. And that would involve partnership, of course, with the city that owns those rights of way, but also with Metrolink first last mile planners who and Metro, who already sees their riders coming to and from the existing busway station and have some ideas on perhaps crosswalks, sidewalk improvements, bike lanes, things like that to make it faster or easier to get to a future station. So by early next year, we hope to have a consultant team on board that can facilitate that entire process. So the siding extension project that I mentioned, construction is anticipated to get going next summer, and that's to build that second track. If you remember, next time I'll have a diagram because it's a little complicated. And right now they're going through city approvals and reviews. And before they start construction, they'll reach out and share construction notices, things like this. And the last project is Valley Boulevard Multimodal Improvements. The city is currently screening a number of alternatives that include bus-only lanes at different times of day. Some options include removing parking. Other options include sticking with on-street parking. And it's my understanding that that process continues with the hope to have some recommendations for preferred alternatives by the end of the year. And the last slide is just my contact info. If you need to get a hold of me for matters on this project or other matters, but happy to stick around for a couple moments and take any questions.
Karina, thank you so much for this overview, and appreciating that we get a chance to work with you to bring a more extensive presentation in the future. But great progress on these projects, and appreciating your time availability this morning. Do we have any questions for Karina? I don't see any in the chat. And I know we are at time, and I want to be respectful of people's time and attention. If you do have questions, please reach out to Karina at kmacias@bos.lacounty.gov. So again, thank you everyone for your time today. We have no time for partner announcements unless there's anything that is super urgent that anyone wants to share. I'll give that a minute. But while I'm giving that a minute, let me share our next meeting. This was an off week, if you recall, because of the Labor Day weekend. So our next meeting is Friday, October the 6th at 8:45 a.m. So again, thank you everyone for your time, for your attention. Thank you to all of the presenters and everyone's care to creating a healthy community here in Boyle Heights, Lincoln Heights, and Sereno, and all of the surrounding communities in Seguro District 1. Appreciating everyone's time, and you all have a wonderful month.